you because it says you're not following me.
We're live on Facebook. Okay, we're going live on IG.
Okay, I'm gonna get in there. I'm gonna join the room.
Good morning, everyone. Thanks for joining us. We are live on Instagram, we are live on Facebook, and we are live on Clubhouse. So thank you very much for joining us. Today it's a special episode. It is an episode with Dr. Fareen Koorjee. Today she's going to be talking about liver detoxification. I don't think she needs an introduction, but I'll still give an introduction because she's one of our regulars. So as you know, Dr. Fareen Koorjee is a naturopathic doctor. She engages in an integrative and holistic approach to medicine by drawing on her 4 years of medical schooling, training, along with 2 years of studies in traditional Chinese medicine and Ayurveda. That's actually a good thing. We just talked about Ayurveda yesterday.
Yeah, we did.
In her approach to care for her patients, Dr. Fareen uses the latest, most advanced diagnostic tools, laboratory testing, and imaging combined with a thorough health history to understand each patient as an individual, uncover the underlying cause of their illness, and create an individualized treatment plan. She draws on modalities of nutrition, Eastern and Western botanicals, and mind-body practices, naturopathic needling, constitutional cupping, IV therapies, and when necessary, pharmaceutical interventions. So thank you very much for joining us. And before we do get started, we do want to make sure that if you are, listening into this conversation and there is any advice that you do please check with your physician in order to make sure that you are getting proper treatment. I'm Fatima.
I'm Fred.
I'm John.
Hi, I'm Cyrene.
Excellent. Let's bring in Dr. Fareen Koorjee.
Yay.
Hello, Dr. Fareen Koorjee. How are you?
I'm good. How are you?
Good. Thank you
Good.
for joining us. So again, can you tell us a little bit about yourself before we get in for our newer listeners?
Yes, so I'm a naturopathic doctor, as you mentioned, and I combine tools of conventional Western medicine and tools of more Eastern naturopathic modalities in my approach to care. I really look at patients from a holistic perspective. So when I do my physical exams, I'm doing it again from that sort of conventional Western medicine perspective, listening to their heart and lungs, checking their reflexes, looking in their ears and their mouth, so looking at any enlarged lymph nodes, doing all this sort of Western medical physical exams. But then I'm also looking at them from a perspective of what is going on, what is their constitution from a traditional Chinese medicine perspective, from an Ayurvedic perspective, to really understand their constitution in that way, and then understand the imbalances that are going on in their bodies. So I really try and use a really kind of broad, holistic, comprehensive approach in my care, and then individualize the treatments to the patients.
Perfect. Love it. So we know that the liver has over 500 functions. I don't think we're going to cover all 500 today. But what is the primary function of the liver?
Yeah, so the liver, you're right. The liver has lots of functions, and each of the functions are really important because without the liver doing what it's supposed to do, the body won't be able to function properly. It's one of the main organs in the body, but its main purpose, as most people know it, is in detoxification. And in Ayurveda, for example, detoxification is a really important part of health. In the modern world, we're bombarded by toxins from the environment, toxins in our food, toxins that we put on our skin. And so it's really important that our bodies have these natural ways of eliminating and processing and metabolizing toxins out of the body. And in Ayurveda, the recommendation is with every change of the season, it's important to do a small detoxification of the body to allow it to function optimally. And the spring is a big time for working on removing toxins in Ayurveda. So right now is a great time that we're talking about this, to really look at detoxifying.
So when you're referring to detox, does that also include excretion, or what exactly does the detox process?
Yes, excretion is so, so important. It is, so our bodies have what we call 6, well, women have 6 and men have 5 different exits for toxins from the body. They're called the emunctories in naturopathic medicine. So the biggest one is our bowel movements. It's a big way that the body removes toxins from the body. And it's really important that we have 1 to 3 bowel movements every day. And it's amazing how many of my patients aren't even having 1 bowel movement a day. And when that happens, what's going on is that these toxins are we produce if our nervous system is in sympathetic overdrive, then sometimes we won't eliminate the stool, and so then those toxins get reabsorbed into the body and circulate in the body. So having 1 to 3 bowel movements is really, really important. And the bowel movements really should be well formed, and it should kind of form like a log rather than pebbles or a pile at the bottom of the toilet. So that's a really big way that the body detoxifies. The second way that the body detoxifies is when we drink enough water, then our kidneys can detoxify our blood. The recommendation with water is to have half your body weight in ounces. So say, for example, you're 120 pounds, then you want to be drinking 60 ounces of water every day. And that allows the kidneys to be able to detoxify the blood properly.
So the water that you're talking about, does that also include the water coming from your food through the digestion process?
No, it doesn't. So you want to get half your body weight in ounces of water that you're drinking outside of food or other drinks that you're consuming. And where the source of your water is it's really important to consider. A lot of people are walking around with plastic water bottles, for example, and xenoestrogens, or synthetic estrogens, that the World Health Organization has said are carcinogenic and highly toxic to the body. They leach into the water from the plastic. So you want to avoid any sort of plastic water bottles as much as you can. Stainless steel and glass are the best. Also, I know here in LA, and probably also in other places, except that I know Vancouver has really good quality water, but you need to be careful because there are a lot of people who are on antidepressants, who are on oral contraceptives, and then they're peeing out the metabolites, and then that gets into our water supply. And so it is important to get a good filter if you're drinking tap water, to make sure that you're filtering out any metabolites or pharmaceuticals that may be coming into our water supply. A lot of pipes in a lot of homes have lead in them. So you want to make sure that the filter that you have is filtering out lead, and chlorine and any other chemicals that you don't want to be consuming into the body. And so there's a Brita filter, which is the one that I use at home, that stands on top of it's a stainless steel filter that stands on top of the counter. It's a really good one, but there's others out there as well.
So besides water, you mentioned food, or just food in general that helps us with the bowel movements. But
yes,
what kind of foods do you recommend us to eat that really helps with the liver function and not kind of stress it?
Yes, so there are a few foods that are really important. So the biggest function of the liver is detoxification, and so antioxidants are going to be super important. And so berries are really high in antioxidants. fruits and vegetables in general tend to be high in antioxidants. Brazil nuts are high in selenium, which is a really nice antioxidant. So antioxidants in general are really helpful for the liver. Foods that are high in fiber also help the liver to detoxify, because the liver metabolizes and removes hormones from the system, especially hormones that are potentially changing our DNA into something that's not healthy. So there are certain estrogens, for example, that can affect our DNA in an unhealthy way that predisposes us to cancers. And so the liver is really important in processing and eliminating hormones. And in order to pull those hormones out of the system, we need to be consuming enough fiber. So oatmeal is really good. Flax seeds are really good. Chia seeds are really good. If you're consuming flax seeds, you want to know that the flax seeds are ground. Whole flax seeds go right through the system and don't have any effect on the body. But the thing with ground flax seeds is that,
Oh no, we've lost her.
You're frozen.
It's a great conversation. That
It's good to know that.
Store.
I'm just hanging on her every word.
yes,
I know, right? The whole flaxseed, and I think whole
What?
chia seed as well goes straight through.
whole flax seeds go straight through and they have no effect on the body. So those volatile oils and those lignans that are really important for us to get, we're not getting. And so it's really important to have ground flax seeds. But when you buy ground flax seeds at the grocery store, the ground flax seeds have probably been there longer than 48 hours.
Mhm.
So the volatile oils have gone rancid. So what I do is I buy the whole flax seeds, I put them into my Vitamix, I grind them, and then I store them in the freezer, because when you store them in the freezer, it prevents those volatile oils from going rancid.
That's a great tip.
yeah, that's interesting. That's very interesting. And so I know we only got to 2 of the ways to detox.
To eliminate toxins, yes. The third is our skin. Our skin is is actually our biggest organ, and we eliminate toxins through our sweat.
Mhm.
And so making sure that you either exercise or you take hot baths with Epsom salts. Epsom salts are high in magnesium, so they can in a very gentle way open up the blood vessels a little bit so that toxins can be pulled out. And then bentonite clay is a really nice binder to pull the toxins out. So taking hot baths where it's hot enough that you're sweating, but you're not going to burn your skin. Often I recommend with my patients that when they're taking these hot baths, they take a cup of hot herbal tea with them. That just increases the core body temperature, so that when they get in the bath, they'll start sweating. Infrared saunas can be really nice to help the body sweat and eliminate toxins. Infrared saunas are really nice because they go into a deeper layer into the fat. And a lot of times what happens is the body is really smart and it doesn't want toxins that are circulating in our bloodstream to get to the brain. And so in order to protect ourselves, the body will encapsulate toxins in fat, and then that fat is held onto in the body. And so infrared saunas go deep into that fat and help to eliminate toxins. But it's really important that we have exit routes from the body of toxins. And sometimes, I'll have patients who have weight gain and stubborn fat that they're not able to lose. And sometimes it's because they have this toxin buildup, and the body has stored those toxins in fat. And then it becomes really difficult because the body doesn't want to let go of that fat because it doesn't have an exit route for those toxins. And it just doesn't want those toxins to recirculate in the system. So the skin is the third exit of elimination. Women have an extra one, and they say that women live longer than men because of this extra organ of elimination. I don't know whether it's true or not, but we have our menses. And so many young women come to me and they want to go on birth control because they don't want to get their menstrual cycle. But the problem with that is we're now closing one really important organ or exit route from the body of toxins. And our menstrual cycle is a really important, what we call a munctry or exit route from our bodies. And sometimes we'll see that there's some months where you'll have a heavier period. It could be a shift in your hormones. Sometimes when you have more estrogen than progesterone, the balance between estrogen and progesterone isn't exactly where it should be, then you can have a heavier period. But sometimes it's just that you've been exposed to toxins and your body is trying to eliminate those toxins from your body. So that's why you may have a heavier period sometimes.
I'm just curious.
Yes.
Once someone, starts menopause, they're not able to do that and that route closes. But is there another way that they can eliminate that?
Yeah, that's a great question because I'm going through that right now myself, and my periods are quite irregular. And I think about that all the time because now I have one less exit of elimination. So it's even more important to me that I'm having those regular bowel movements, that I'm drinking enough water, that I'm, taking regular baths, and I'm exercising regularly and sweating regularly. And then there's two other exit routes that I haven't yet mentioned that are really important and more kind of mental, emotional than physical. But they're really, really important. And we tend to kind of ignore them. And I know a lot of times when I talk to my patients about them, they're ones that that are often a little bit more difficult to carry out, but they are just as important. So when we think about our emotions are another exit route of toxins. And with our emotions, a lot of us have been told in childhood to not cry, not get upset, to not get angry. And we learn these coping skills of suppressing our emotions. And then we carry that through into adulthood where we're suppressing and we're stifling our emotions. And there is such a big mental, emotional connection with what's going on physically. So when we're energetically stifling and suppressing our emotions, it actually has a physical effect of pushing down toxins further into the body. And so having really healthy, really safe ways of processing emotions is really important. And some ways are talking to a therapist or a counselor, journaling. Some people don't like the talk therapy, and so journaling can be really effective. Spending time in nature, talking to friends, meditating, these are all ways that we can process emotions, and then allowing ourselves to feel what we're feeling in the moment when we're having a certain emotion come up for ourselves. And then the last one is breath. And so a lot of us in the modern world that we live in have learned to breathe in a really shallow way where our breath just goes into our chest. But if you look at a baby, you'll see that their belly rises as they breathe in and relaxes as they breathe out. And that is really the way that we should be breathing. Breathing into the belly and then breathing out through the nose is really puts us into what's called the parasympathetic nervous system, which is the rest, digest, relax nervous system, instead of the sympathetic, which is the fight or flight stress response. And so if we have a breath practice, even if it's only 10 minutes a day, it retrains the body to breathe more deeply. And when you're taking a deeper inhale into the belly, you actually end up taking a longer, bigger exhale. And when we exhale energetically, we're letting go. And we, again, that mental, emotional, physical connection, when we're breathing deeply, we're actually allowing the body to physically let go of toxins as well. So breath work is something that I talk to a lot of my patients about. And it's an important piece. And it's important, I think, to incorporate that, even if it's just 10 minutes a day, when you wake up in the morning or before you go to bed, it is really important. So those are the 6 organs of elimination, exit routes from the body. And the liver is the organ that metabolizes all of these toxins. And John had mentioned earlier that the liver really is the only organ in the body that regrows itself and regenerates itself. So it has that great function of being able to do that. Yeah, and there's an herb called milk thistle that is really helpful in helping the liver to heal itself. It has what's called hepatic trophorestorative properties that allows the liver to heal itself when it has been damaged. And some of the things that can cause damage to the liver are toxins. Others are eating too much sugar. So when you eat too much sugar, that sugar gets converted to triglycerides, and you can see what your triglycerides are, the level of your triglycerides if you do a lipid panel where you're looking at your cholesterol. So triglycerides are a type of fat. And you can also look at your sugars with, there's 3 different markers for that. You can look at in your complete metabolic panel, there's a blood glucose level, hemoglobin A1C is a sugar marker, and then insulin. Those are 3 sugar markers. And the more sugar you have in your system, the more fat in the form of triglycerides that you're forming. And triglycerides get stored around the heart and they get stored around the liver. And the more triglycerides you have in your system, the more damage those triglycerides do to your heart and your liver. And then we see liver enzymes going up. Liver enzymes are proteins that the liver releases when they're starting to damage to the liver. And so those are things that you can look at on your blood work to see what's going on with your liver.
So if you were to look at someone who has had a dysfunctioning liver, what would be sort of the conditions that come out of that?
So it really depends on the severity. You know, it can be something as severe as cirrhosis, which is kind of like a fibrosis of the liver that happens over years when we have things like alcoholism. So alcohol is a sugar, and those sugars get converted to triglycerides, and then they get stored around the liver and do damage to the liver over years, and then you can get cirrhosis where the liver isn't functioning at all. You can have, you know, just minor damage to the liver if you're taking too much Tylenol, if initial stages of drinking too much alcohol or taking in too much sugar, if there's a toxin burden. Those are sort of the 2 extremes. But what you would see in the body is you would see what we called right upper quadrant pain. So the liver is located underneath the ribs on the right-hand side of the body. And so if you were to poke just underneath the ribs there, you might feel a little bit of pain. And even someone who doesn't have severe liver damage, if you're having pain in that area, it could be it might be an indication, but not absolutely. It might be an indication that the liver is starting to signal that something isn't right. And it's really nice, I think, to listen to those signals, because I think anytime there is a symptom in the body, it's the body's way of communicating with us that there's some sort of imbalance, and we need to listen to that. You know, sometimes I've had patients who come to me and they say, you know, I went to my conventional Western doctor and they say there's nothing wrong with me. But I have these symptoms and they're real. And to me, it's really important to listen to those symptoms, because if we don't listen to our bodies, what happens is these small imbalances that are just signals that things are starting to go off balance end up turning into disease. And that's generally when a conventional medical doctor has the tools to do something about it. But for me, and they have great tools, but for me, I'm really wanting to prevent patients from getting to a place of disease. So I'm really looking at those symptoms and signals even in their blood work. My ranges are so much tighter than what a conventional medical doctor would look at, because a conventional medical doctor is really waiting till you get to a place of disease for most things, because that's where they shine. That's where they, know what to do. They have pharmaceuticals, they have surgery. Those are their sort of tools. And those ranges also are for the average North American population. And I'm wanting my patients to be much healthier than the average North American population.
Wow, this has been very informative.
Mary.
Do you guys have any last questions for Dr. Fareen?
I don't have any questions, but it just sounds like even if we don't have all these heavy burdens, like the extra, what we're taxing our liver with, the liver's already overworking, like it's already doing its job. It's doing its best to kind of keep us healthy. So I guess the things that we can do is make these lifestyle choices to, eat healthy, to sleep well, to meditate, to de-stress, and all these, infrared and stuff, so that we're not giving more work to it that it's already, it's already on medication. And that, it's kind of like you want it in this little median, and then it's already kind of going above it. And then, then we add more to it, and, stress, and, for women, menopause and stuff. So our life is kind of going up and down, and our liver is trying to manage it. And sometimes it cannot. And when it cannot do what it's going to do, that's when you're saying that we're going to get some of these symptoms come out, and we don't know what they are. Yeah. So.
Yeah. And there's some things that you can do on a daily basis to support the liver, some lifestyle things. Castor oil is something that you can get at the grocery store. Organic castor oil is highly anti-inflammatory. And if you're having any pains in your liver, obviously go see a doctor first. But if it's just sort of signals that something might be starting out, castor oil can be really nice if there's any inflammation in the liver. You put it over the liver, just sort of over the right side of your abdomen, and then you put a hot pack on top. So you take the castor oil, it's very thick, so you don't want to be wearing your best clothes when you're doing this. You
remember that.
Yeah. You massage it onto the right side, and then you put a hot pack on top for about 20 minutes before you go to sleep. And the hot pack drives the castor oil deep into the liver, and the castor oil is highly anti-inflammatory. Dry skin brushing is another thing that we can do, because the lymph is a really big, the bloodstream brings nutrients to the cells, and the lymph takes toxins away from the cells. And so the lymph, there's a thoracic duct that's kind of on the left side near your neck. And that's where all the toxins kind of accumulate and then are removed from. And so if you do dry skin brushing, where you're brushing your skin really gently, because the lymph is right on underneath the surface of your skin, it doesn't have to be a hard brush at all. So you're brushing kind of towards the heart, where the thoracic duct is, before you take a shower every morning. That can be really helpful. There's something called oil pulling. So our digestive tract, when we're sleeping, produces what's called autotoxins, which are toxins from the system that then get put onto our tongue and in our mouth. And so if we end up drinking water or consuming something first thing in the morning, then we're allowing those toxins that are on the tongue to go back into the body, and then they recirculate. And so first thing in the morning, every morning, I do what's called oil pulling, where I take a half a teaspoon to a teaspoon of organic cold pressed coconut oil, and I put it into my mouth and I swish it for as long as I can. They say 20 minutes. I can't always do 20 minutes, but just do it as long as you can, and then spit it out, and then just gargle with some water. And that organic coconut oil is antimicrobial, so it keeps the microbiome in the mouth really healthy, and it pulls out any toxins that are on the tongue. That's another thing you can do. The infrared saunas, the baths, exercise is really important. Drinking enough water, getting enough fiber so that you're eliminating through your bowel movements. I'm trying to think. Chlorophyll is also really nice. It oxygenates the cells, and it helps to remove toxins from the system. Glutathione is really nice. It's one of the most powerful antioxidants in the body, and the liver uses up glutathione when it's detoxifying. The thing with glutathione is it's not as effective when we take it orally. It's 100 times more effective when we're taking it intravenously. So a glutathione push can be really nice if you've had a big toxic burden. So toxins can come from, as I mentioned, lead in the water. It can come from mercury fillings that are in the mouth, because those mercury fillings release vapors that we then, it's very small amount of vapors, but we then swallow those vapors, and it's happening on a daily basis. So over time, we can really accumulate mercury into our system, which really affects the nervous system and other organs in the body. It can come from fish. Tuna and swordfish are really high in mercury. You want to make sure that you're getting, fish. If you're having it on a daily basis or more than a couple times a week, you want to avoid fish that's high in mercury. You want to get salmon that's wild caught and not farmed. Mycotoxins, so mold, and this is a big issue, I think, in Vancouver, mold in the buildings. If you see any mold in your apartment, in your bathroom, that mold, when it feels threatened, it will put off toxins called mycotoxins. And then we breathe in those mycotoxins. And the thing with mycotoxins they are really, they're really tricky. They trick our detoxification pathways, and they trick and hide from our immune system. So our immune system is the part of our body that's supposed to figure out what is ourself and what should not be there, like bacteria and viruses and toxins and cancer cells. And then it's supposed to find those things and get rid of them. But with mycotoxins, they really hide in the body, and the body can't get to them. So even if you've had an exposure decades earlier, you might still have mycotoxins in the system. And the reason why it's important to get rid of mycotoxins is because the World Health Organization has said that mycotoxins, if left in the body for a long period of time, actually are carcinogenic and cause cancer. And so that's a really big source for a lot of people of toxins. So it's something that we can test for with a mycotoxin test. But just, there's toxins everywhere, really. Pollution, and if we're not getting organic foods, if we're not getting grass-fed beef, then a lot of times we're getting xenoestrogens in our, just like we get them from plastics, you can get them in the meats that you're eating. So avoiding any sort of plastic water bottles, avoiding plastic containers that you store food in. I would recommend, I know Costco has a really good deal on right now here in LA and maybe in Vancouver on glass containers. Avoiding aluminum foil, because aluminum predisposes us to Alzheimer's. There's lots of toxins in the system. So, we can't always do anything about our environment. Necessarily, sometimes we can, but really making sure that we're eliminating toxins is really important.
Wow.
I know, I was about to say that too.
Wow.
I'm gonna have to watch that again.
I know.
That repeat over and over and over. That was so informative. So thank you so much for coming on,
Yeah,
Dr. Fareen.
Yes, thank you.
My pleasure.
I understand one thing. I hear you loud and clear.
What's that?
Do it early, to adjust your lifestyle earlier, so you're not having these things compound over time to deal with it. Can you imagine us having to deal with, if we did it earlier, we'd be here. But if year after year after year, and then
The thing is, when we're younger, we're just so invincible, right?
Right.
We're so invincible. We can drink, we can do whatever.
So we thought.
So we thought, and then we get older and we're like, I should have.
But you know what, Fred?
Yeah.
It's not that we're invincible as well. It's that when we're younger, these things have not collected in us.
Yeah.
Exactly. It's not that we're invincible. We're nourishing it for later.
Yeah, we're actually brewing these things to happen later on, right?
Yeah.
So
As Fareen said, when we have imbalances, these imbalances start in our system when we're children. And that's why I love working with I work mostly with women, but with men as well. I love working with young women because you can catch it early on before it gets to a place of dysfunction that is so out of balance. It takes so much more to work
Yes, that's
backwards than to
That's
prevent
very
it.
true. Mhm.
And a lot of times when we see a symptom, it's because we've reached a threshold. But those imbalances, as Fareen said, have been developing year after year after year. And it's only when we reach that threshold that we actually see symptoms. And then even years, it often takes years after that that you seek help from a healthcare professional. And
that
so those
costs a lot of
imbalances,
money, doesn't it?
what's that?
It costs a lot of money then if you
Yes,
wait
it
too long.
does. Absolutely. Yes. And I know we're talking about the adrenals next time, but absolutely with the adrenals, this idea of nourishing them and working with them at an early age is going to be really important. So stay tuned and we'll talk more about that next time.
Segue, that's an awesome segue. Thanks.
Especially in menopause and perimenopause, it's going to be really important to work on it earlier and when we're sort of first getting our period.
I think we opened up probably another dozen topics for future talks.
I know, right?
I know.
I need to see you.
Anytime.
So as Dr. Fareen mentioned, next month, May 14th, Friday, May 14th, we're going to be talking about the adrenals. And so you definitely want to stay tuned and come join us. If you haven't had a chance to check out our birthday challenge, please do so. It's still going on. So you want to let us know why you are our #1 fan. And that way you'll actually get a chance to be on the show with us and you'll get to ask us questions, not us
The other way
asking.
around.
Yeah. So you'll actually get to ask us some questions, which is kind of cool. And then on the 27th, we're going to be talking about nasal and allergies. On the 29th, we'll get back to you. We're trying to figure out our guest speaker. So we'll get back to you on that one. And then, where is it? There we go. Then, yeah, we'll get back to you.
Yeah.
We haven't gotten that far, so we will get back to you as to what our next topics will be. But again, stay tuned for May 14th, where we are going to be talking about adrenals. And if you have any questions, please put them in the comments. And if you haven't followed us yet, please follow us on all of our platforms, The Healthy Wave Vibes. We're on Facebook, we're on Instagram, Clubhouse, YouTube. We're everywhere, The Healthy Wave Vibes. And thank you for joining in and have a wonderful day. Bye for now.
Thanks for tuning in. Thanks, Dr. Fareen.
Thank you, guys.
My pleasure. See you guys later.
Bye.